on health issues, diseases, and disorders. Now, due to the complexity of the subject that we discussed last Friday, that's on prostate cancer, we have brought you this second session just to give you a complete perspective of this prostate cancer. Now, Professor Ahmed Kiswezi, welcome again to our studios. Now, maybe you tell us briefly about the prostate cancer sensitization that was organized last Sunday.
Thank you very much. Now, following our discussion here at our Mater Health Center at the Karen Well Mall on Sunday, the 15th of this month, we received about 34. The number was 34 men who came for screening. This was a good response, and we, in fact, although we had expected even larger numbers, because as we said, these are people who did not have any symptoms, and usually this cancer comes in many people without symptoms. So the ability to come and check oneself is a very good kind of behavior. My appeal to the population is that let us adopt the European way. The Europeans and Americans, even when they don't have a complaint, they go to check themselves. And this is why their diseases are detected at a very early stage. And then when this happens, the treatment is not complicated. Now, among us, the 34 we screened, I was told by the colleague who did so that 8 were found with the features suggestive of cancer of the prostate. And this is a very good catch. So if it is 8 out of 34, you can imagine what we would get if we had 100 men. So the appeal goes to the whole public, those who are viewing us, that we need to wake up. Let us not wait for symptoms, because the majority of people who develop cancer of the prostate don't have symptoms. And the reason why, for example, in the United States, their 5-year survival for patients who have been diagnosed with prostate cancer is about 98%. It is simply because they diagnose the cancer of the prostate at a very early stage, where curative surgery is possible and even the medicines are not complicated.
Thank you, Professor. That's Professor Ahmed Kiswezi, a general surgeon and medical trainer, COSEXA. Now, last Friday, just to give a recap, we touched on what prostate cancer is, the prevalence rate in the general population, risk factors that predispose one to developing a prostate cancer, the common signs and symptoms, and we also touched on the diagnosis and available treatments. Now, today we are going to go into details. And to start off, Professor, what is benign prostate enlargement? Because most of the time it has been mistaken to be prostate cancer.
Oh, thank you very much. Now, the prostate gland, like other glands from the human body, it has a list of diseases, maybe perhaps about 8 diseases of the prostate, one of which is cancer of the prostate, the other one being benign prostate hyperplasia or benign prostate enlargement. Now, the term benign prostate enlargement simply means that although there is no cancer in this prostate, no proven cancer yet, as the man grows beyond the age of 40, the prostate cells increase in number. Now, there is fibrous tissue deposition and the cells multiplying rapidly, and therefore they grow bigger and bigger. The gland grows bigger and bigger. Let us remember anatomically that the tube that through which the urine passes from the urinary bladder to the outside passes through the prostate. After leaving the urinary bladder, this tube passes through the prostate gland. Now, unfortunately, this prostate gland, it is enveloped by a bone. It is within a bone. So the outside borders of the prostate gland are bones of the pelvis. so much that when there's enlargement, because it is limited by the bones, the enlargement will grow towards the inside, causing compression to the urethra.
All right. Now,
and therefore, that one is a big problem also, although it's not cancer, because it causes urinary tract obstruction. The patient gets failure to pass urine. Eventually, when this prostate grows bigger and bigger, even the blood supply increases in it, causing bleeding into the urethra. So many times they come and say, I'm urinating urine, or I'm urinating blood, or I'm passing urine which is mixed with blood.
Could someone with BPH be at risk of developing prostate cancer?
Now, yes. Although the two diseases are different entities, cancer of the prostate is different from benign prostatic enlargement. The two may coexist.
All right. So what is the percentage?
And the percentage of from statistics, it has been realized that if you have 100 men with benign prostatic enlargement, about 20 to 30 of them will have both the benign prostatic enlargement with cancer of the prostate concurring. And so that means that about 20 to 30%. Now this means that every time we remove a prostate because of benign prostate enlargement, we take it for further histological analysis to prove whether there is no cancer. And unfortunately, even when somebody may ask, if I've had my prostate removed, do I still have to worry about cancer of the prostate? The answer is yes. Why? Because when we remove the prostate because of benign enlargement, we usually don't disturb its capsule, because the capsule is surrounded by blood vessels and nerves, which may cause complications. No. So when we remove the prostate because of benign enlargement, called BPH, the capsule which remains behind is a center where cancer usually comes from. Meaning that when your prostate has been removed because of benign prostatic enlargement called BPH, you are not entirely free from cancer of the prostate. You can still have cancer of the prostate despite the fact that you had removal of the prostate.
Yeah, I think that is one of the misconceptions about prostate cancer that we'll be looking into later on. Now, should people with BPH be worried? Maybe what exactly should they do in order to ensure that they are safe from developing prostate cancer?
To emphasize that everyone with the symptoms like poor stream of urine, failure to urinate, sometimes he has failure to pass urine, and sometimes blood in the urine, and like urgency, frequency of urine, especially at night, they should go for checkup, because even if you have been told that you have benign prostatic hyperplasia, which is BPH, as I said, in about 20 to 30%, the BPH exists together with the cancer of the prostate. Therefore, it is worthwhile. And even if there was no blood cancer, the fact that you have urinary retention, because when you fail to pass urine alone will cause complications like toxemia in the body, and you may even die because of that. So, meaning that every time, once you detect that there's a problem, don't hesitate. Rush the for medical checkup, and then the checkup will do a number of activities, a number of checks, including clinical, laboratory, imaging, to discover what you have, and to find out whether you have only one entity called BPH, or you have both BPH and cancer of the prostate.
Thank you, Professor. Now, does prostate cancer increase the risks of developing other types of cancer?
No. But I would like to say that the opposite is true. Other types of cancer may be an indicator that you have a risk for prostate cancer. Now, because first of all, other types of cancer may even be in females of the same family. For example, breast cancer, which may be either in a man or a female. About 10-20% of breast cancer is familial, and it has a genetical risk factor. Therefore, it means that if in a family you have had someone, a close relative who has had breast cancer, ovarian cancer, pancreatic cancer, it means that you may be having a genetical association which within that family may predispose you to cancer of the prostate, because they all move together. Let us remember that about 20% of cancer of the prostate is genetically associated, and it is this amount which we really look at when there's a familial tendency of other cancers, like as I said, breast cancer, pancreatic cancer, ovarian cancer.
Thank you. Now, last Friday you gave us some of the available treatment options for people with the prostate cancer, and prostatectomy and radiation therapy are one of the ways to treat cancer of the prostate. Now, which one between the two do you recommend, and how can someone know that one works best for them?
Okay, thank you very much, sister. Now, we have a variety of treatments when we make a diagnosis of cancer of the prostate. One of the number of treatments, the range of treatment depends on the stage of the cancer. In early cancer, meaning that the cancer of the prostate has just started in a small area of the prostate, it has not even spread to the borders, to the neighboring structures. In this type of cancer, at this stage when it is so early, we can do radical prostatectomy, meaning that we remove the prostate with its capsule. Now, this is in many centers which this has been practiced, it is regarded to be curative surgery, meaning that the patient may live for long without the risk, without a complication of the complication arising from prostate cancer, because the cancer may go forever with this kind of surgery. Unfortunately, if the surgery is done late, it is not curative but palliative, meaning we are just trying to extend your death to another year.
So, in other words, you mean the type of treatment depends on the stage?
Yes. Now, radiation therapy is using X-rays, the beams from X-rays to kill the cancer cells. This is one of the things that we do, but unfortunately, many times it is only when we are dealing with the advanced disease that we may need radiation therapy, because this one will mop up the cells which are spreading to the bones, to other structures, but also it will also help to reduce the pain, alleviate the pain. And so, for example, if someone has severe backache because of a spread of prostate cancer to the backbone, then the radiation will reduce the pain by reducing the spread.
Okay, in line with that, someone asked in our previous session that what are the chances that a prostate cancer patient might develop other complications in the course of treatment or after treatment, for instance, urinary complications or the rectal system complications?
Thank you very much, sister. That's a very good question. To our viewers, every medicine has a side effect, and every treatment may or may not end up with a complication. Now, when it comes to cancer of the prostate is hidden deep in the pelvis, and it's a neighbor of many structures, delicate nerves, some of which are nerves of potency, meaning sexual potency, a lot of blood vessels surrounding it. Therefore, it means that now it takes careful surgery and experience to say you are going to remove the cancer, the prostate, without causing a number of complications. That's when we usually try to do as much as possible using our experience and when you are in good hands, especially in the specialists who know what they are doing. Of course, this means that now if you seek surgery for it, you have to go to safe hands. Secondly, when it comes to drugs that we give, the more advanced the cancer is, the more advanced your cancer of the prostate, the level of advancement, the more we are going to combine drug A, drug B, drug C together. But each drug carries a set of side effects. And if you combine a drug, say, which let us assume that each drug has 2 or 3 side effects. But because of the higher level of your disease, it is advanced, we are going to be forced to combine 2 or 3 drugs. That means that we are going to add up complication of drug A plus complication of drug B plus complications of drug C, and then you have a cocktail of complications or other side effects. Now this means that because of this, we may have a number of complications, which we usually see, and some of the complications that we see with the oral side effects of the drugs is reduced libido, and eventually you may have impotence because the drugs chemically castrate the person. Yeah.
Now, what about baldness? Because this has been associated with some kind of treatment for cancer.
Now, in addition to the hormonal therapy, because the drugs I was talking about reduce the androgen levels. Now, we also have another set which we use in advanced cancer of the prostate called chemotherapy. That is purely for which they also use it for other cancers. Now, these drugs cause a number of adverse effects, including body change, darkening of the skin, tarnishing or removing your hair. However, these complications are short-lived. In about 1 month of use or 6 weeks of use, the body changes, may go back to normal.
Thank you so much, Professor. We're taking a very brief break. We'll be right back with more on Around the Table show. Stay tuned.
Amri za Mungu. Ndimi Bwana Mungu wako. Usiabudu miungu wengine. Usilitaje bure jina la Mungu wako. Shika kitakatifu siku ya Mungu. Waheshimu baba na mama upate miaka mingi na heri duniani. Usiue. Usizini. Usiibe. Usiseme uongo. Usitamani mwanamke asiye mke wako. Usitamani mali ya mtu mwingine. Amri za Mungu.
Kupata
amri za Mungu.
Kama sikiza tune yako, bonyeza neno sikiza likifuatwa na nambari 738102551.
Welcome back to our Around the Table live show, and thank you so much for keeping tabs with us today as we discuss the second part of our prostate cancer. Now with me in studio is Professor Ahmed Kiswezi, and on we move. Now Professor, for how long can someone with prostate cancer, someone who has been diagnosed with prostate cancer, survive, and are there ways to mitigate suffering and maybe prolong their lives?
Yes, thank you very much, Sister Elizabeth. Now, first of all, I would like to appeal to the viewers that the cancer, every type of cancer, kills. And the cancer of the prostate is one of the killers. In fact, in the worldwide figures, it is number 5 killer in the whole world. Now, unfortunately, if the disease is discovered, if we make a diagnosis late, the chances of dying from prostate cancer are higher, because cancer may start from the prostate, then it will spread to the bones, to the liver, to the lungs, to the brain. Meaning that if the cancer is diagnosed early, there are chances of mitigating the spread and therefore prolonging life. And so, if the cancer is diagnosed early, like I said, in the United States, where they make a diagnosis of cancer of the prostate when it is still in stage 1 or 2A, meaning it is still confined to the prostate and a small area of the prostate. They remove the prostate by radical prostatectomy, and they give some medications. The 5-year survival rate in the United States is 98% of people who have been diagnosed with prostate cancer. Unfortunately, in our East Africa, the picture is grim, and I pray that God helps us to improve. Because most of our patients with prostate cancer, the diagnosis is made when the stage of cancer is stage 3 or stage 4, meaning it has spread to go beyond the capsule of the prostate cancer, beyond the prostate capsule, it has gone to the pelvis and to the bones of the vertebra, and many times it has even reached the lungs. This is at this time that we usually make our diagnosis of prostate cancer, and this reduces our 5-year survival chances to about 10-15%.
But are there hopes for someone who is diagnosed at a later stage? Are there options for them?
Yes. Now the option is that we give, and the emphasis is, even when the diagnosis has been made late, as late as stage 3, stage 4, adhere to treatment and follow up. Once this is done, adherence to treatment instructions, adherence to follow up, the chances of survival may be improved. Now, what reduces our survival chances is when we default treatment or when we seek alternative treatments which have not been proven to work.
Thank you so much. Now, last Friday, we touched a little bit on a recurrence of cancer. What is the percentage risk of recurrence in prostate cancer?
Now, okay, thank you very much. Now, recurrence of prostate cancer, if, for example, you have undergone prostatectomy because of BPH, and then they find there's also cancer of the prostate in the sample, the amount of prostate they removed. You can have a recurrence from the capsule, which is usually left behind. The other one is, if you have treatment of prostate cancer and the measures as we follow up show that it is completely reduced, are there to follow up, are there to treatment? Because once you relax saying, no, the disease has now gone because the symptoms are reduced, the cancer will come back to recur. It tends to recur usually. We have on record a number of patients who have been discharged from hospital saying you are now okay. You can now come after 3 months. You can now come after 4 months for follow-up. And then when they default follow-up, they don't go back because of either poverty or seeking alternative treatment or believing that they are cured. The cancer comes up, and then when you measure we usually use the PSA to measure. When you measure the PSA, when it has gone down, it may go to normal levels. Then when the patient doesn't go back for follow-up and spends more than 6 months, they may come back when the PSA has gone very high again, indicating that the recurrence has occurred. And when the recurrence occurs, it gives chance to this cancer now to spread to other areas, to involve soft targets like the lungs, the liver, even to reach the brain.
Now, there are some misconceptions and myths surrounding prostate cancer, and some of them touch on the treatment. Some people think they can opt for alternative treatments like the herbals.
Now, thank you very much. Now, this is typical in our African situation. We tend to believe in herbal medicine. Sometimes we may even believe this was witchcraft, or we may even disbelieve in the doctors, what the doctors are saying, because sometimes there's a cost, you don't have insurance, this and that. Now, whenever you seek treatment from unproven centers, the risk is that you risk the advancement of the disease. For example, there's no proof that herbal medicine, while I'm not trying to say it never works, there's no proof, written, documented proof that herbal medicine works on cancer. Because we have had, for example, people with breast cancer coming back, I was in Chinese medicine, I was in herbal medicine, when the cancer has instead advanced. Therefore, it is risky to go to seek alternative treatments like herbal, Chinese what. This is risky because there's no proven evidence, and I will not be surprised if you come back, and by the time you come back, the cancer has progressed to advanced levels. Therefore, and then the other risk is that the alternative treatments like herbal and Chinese may not have a mechanism of monitoring the progress of the treatment vis-a-vis the progress of the disease.
Thank you so much. Another misconception is that prostate cancer is sexually transmitted. How true is this?
This is not true, because studies which are looking at married people who are sexually active have looked at the tendency of their female partners having a risk because of the male's cancer of the prostate. Cancer of the prostate is specific for that organ, and the sexual involvement does not transmit the disease. There's no evidence and doesn't happen. Therefore, it is a myth.
All right, another one, that prostate cancer is a slow-growing cancer, so someone needs not to worry about it getting ugly at some point. Now,
this is partly true. Prostate cancer, compared to other cancers, moves slowly, slightly slower. I would say it moves more slowly than liver cancer or breast cancer. It is a bit, if you are comparing the advancement of the cancers against time, it moves a bit slowly. And that's why, but this does not mean that somebody should not seek treatment, because if you may believe that slow growing and then you get complications later. However, if it is true that cancer of the prostate moves slowly, and it is because of this that if, for example, a man who is 75 or 80 years is discovered with the early prostate cancer, we may watch this patient because we may say at this age he has comorbidities. He may die of other things because the cancer may kill him after 10 years. So maybe like that it is slower growing. However, it depends on the amount of immunity. It depends on the amount of the other comorbidities that may weaken your immunity. Because immunity, your level of immunity has a bearing on the advancement of the cancer, because immunity, the body's defense, checks the advancement of the cancer. Now, while it is slow growing in people with good immunity, if you have comorbidities like diabetes, like hypertension, like what, and other diseases, chest infection, and so on, your cancer may progress faster. So let us take the slow growth with a pinch. In other words, let us be careful with this statement, because if you have other factors which may compromise your immunity, the type of feeding you have, the what, and so on, you are in stress, your cancer may advance faster than expected.
Thank you, Professor. Now, in our last or previous session, you mentioned that if cancer runs in the family, then you are at risk of developing cancer.
Yes.
Now, some people might get comfortable that now that nobody has ever been diagnosed with cancer in my family, the odds are less, or they are not great that I will get it.
Yeah, thank you very much, sister. And this is another myth. The belief that since in our family nobody has ever had prostate cancer, it does not mean that you are free from developing it. After all, it has been discovered that about 80% of prostate cancer patients don't have a family history, meaning that in about 80% of the disease, there's no family history. That implies that every man, as long as because the greatest risk factor is age, as long as a man is above 45 years, the risk increases every 5 years. It may keep on doubling.
Thank you. Now, there are some research articles, science articles online, several of them claiming that people who are sexually active are at a lesser risk of developing prostate cancer, while some claim that sexually active people, or rather men, are at a higher risk of or rather developing cancer.
Now,
what do you say?
Thank you very much. This is a very interesting myth, because the belief is real, and people tend to associate sexual activity with they don't tend to think that people who are more active, sexually active, have a lesser risk. But a number of studies I've read a number of studies from the United States, and also one study from Canada, another study from Great Britain, which indicate that about marriage, and they were looking at marriage and unmarried people and how they fare with prostate cancer. Now, the association was that married people were found to have a lesser tendency of death because of prostate cancer. But now the analysis went ahead to say it's not because of the sexual intercourse. It's because of the care. Married people will eat on time because they have their wives take care of them, and they'll change their diets and so on. They even have psychological care, the emotionally cared after. And the other thing which may even be in our environment here, married people who have families are mindful about having medical insurance. So they even have medical insurance and promptly go for treatment. Therefore, they have family support, they have psychological support, which will help them even to get medical insurance. Unlike unmarried people who may not have insurance, may not have meals on time. Therefore, it's the care and the responsibility which is more useful other than the sexual intercourse.
Please shed more light on the age issue, because some people believe that prostate cancer is for old men.
Now, of course, first of all, we have a proverb in medicine which says that diseases don't read the books. And then we also have another proverb which says that surprises will never end in medicine. I'll first of all give one example of breast cancer. When I was a student in my undergraduate classes, we used to think that breast cancer is for all the grandmothers. Now these days we are seeing breast cancer at 18 years of age. Similarly, while the prostate cancer in older books, older literature suggests that prostate cancer is for men above 75. Now we are seeing it for men, with men around 50 years. That means that the checking of the screening of prostate cancer should go down to as young as 45 years, because a number of men have been found at 55 years with prostate cancer, and it's not a surprise if a man at 50 or 55 is discovered with prostate cancer. Meaning that now the paradigm shift is going towards the lower age, which should not happen. So this is the kind of trend that the medicine moves, not only for prostate cancer but even other diseases, that diseases can change trends. The older trend was that it is in men who are elderly. Now it's moving to the younger generation, to involve the younger generation. Of course, the advice is that if you are above 45 years, the older you grow beyond 45 years, the risk of cancer also grows. So it is worthwhile to keep on monitoring, to check whether you have symptoms. You don't need to wait for symptoms. It does not mean, no matter whether you don't have any history in the family, any family history of prostate cancer, the advice is check, and find out, so that if you have a risk or if the cancer develops, early diagnosis may save your life and you may live longer.
Now, before we wind up the discussion, could you please tell us from your experience the socio-economic implications of prostate cancer?
Yeah, fine. Thank you very much. Now, the listeners should also see that prostate cancer is expensive. The more you delay to have a diagnosis, you come with advanced disease. The more advanced the prostate cancer is, the more expensive in terms of medical expenses it is in treatment. That means that if you are to compare 10 wealthy men with 10 poor men with cancer of the prostate, the 10 poor men will have chances of dying early, which have chances of the chances of dying early, the chances of getting complications of their cancer are higher than the wealthy men, simply because the wealthy men have access to high quality cancer care. They will have access to early treatment. They will have access to every hospital they want. You have known that some of them even go to India where to have treatment, high-tech treatment for cancer. Whereas the poor men will not have this access, and then they have their death will come early. Likewise, even the kind of feeding, the kind of so in other words, the more wealthy the patient is, the better. But what should happen for a poor person? Early diagnosis is the key, because if your cancer is diagnosed early, even if you are poor, where even NHIF may help you to get treated or operated. If you have early treatment, you may benefit as much as the wealthy person. Secondly, the more you delay to have the treatment, and then you come with complications. We shall add drugs A, B, C, D. Which drugs will cause complications like loss of libido, impotence, because they virtually castrate you. And of course, if you don't even have the money to buy those, because the drugs are expensive, which is another factor. Drugs like Zoladex, Casodex, you may find that it is like 300,000 Kenya shillings a dose of a month. In other words, so if you can't afford those drugs, we surgically remove your testes, because the objective of the other drugs is to reduce the androgens. So even when we remove the testes, we are reducing the supply of androgens. But then the implication is that what will happen in the relationship, your relationship with your spouse, it becomes a big question. And yet, you need this care because the spouse is very important in as far as the care is concerned, because married people fare better. They get better care than unmarried people.
Now, could you please give us your final remark, or rather give the audience your parting shot just before we close this discussion?
The listeners, first of all, I would like to summarize that the key to solving most of our problems, especially in East Africa, is to have early diagnosis. Let us seek early diagnosis by going, even when you don't have symptoms, endeavor to go and check yourself. Like we should also endeavor to even check for other diseases. This is the culture in Europe and even in Americas, and that's why they happen to diagnose their diseases early. So it is cheaper if the disease is diagnosed early. It is more expensive and more life-threatening if the disease is diagnosed late. Now, also finally, let us avoid the misconceptions, because there are many misbeliefs, beliefs which don't hold any water. Like, for example, my family doesn't have this, I don't have symptoms, because they don't hold the water, and these are misleading. With that, I would like to end. Thank you very much.
Thank you so much for that profound session, Professor Ahmed Kiswezi. Now, just to emphasize some of the main points from last Friday's session and today's session, both on prostate cancer, is that prostate cancer is one of the asymptomatic type of cancer in oncology. Actually, one of the most asymptomatic. So if you don't have symptoms, you still have to go for screening just to ensure that you are on the safe side. And another thing is that blacks are more susceptible to developing prostate cancer than whites, because there's no any scientific reason behind that, but we hope soon it will be there. Then of course, you can have some signs and symptoms like the benign prostate enlargement. That is not suggestive of prostate cancer. So the best way to go about that is just to go and confirm. Now, thank you so much for creating time for this live show around the table with me, Asasha Elizabeth. Now, see you next Friday. My name is Asasha. Goodbye.
Amri za Mungu. Ndimi Bwana Mungu wako. Usiabudu miungu wengine. Usilitaje bure jina la Mungu wako. Shika kitakatifu siku ya Mungu. Waheshimu baba na mama, upate miaka mingi na heri duniani. Usiue. Usizini. Usiibe. Usiseme uongo. Usitamani mwanamke asiye mke wako. Usitamani mali ya mtu mwingine. Amri za Mungu.
Kupata
Amri za Mungu.
kama sikiza tune yako, bonyeza neno sikiza likifuatwa na nambari 738 10251.